Okay, next we proceed to chapter number 12, limb development. It is very important chapter. From specialized embryology, from among all of your three chapters, this chapter is very important, development of limbs. From development of limb, the first SQ to be asked is your limb growth and development. The question comes like, justify the proximo-distal axis of the embryo and development of the limb or topographical location of the limb. So you have to write from here to here, but I will provide you all of the information in a flowchart manner, and that would be more than enough. Justify the topographical anatomy of the embryo. Students are often confused with the question justify the topographical axis of the embryo. In topographical anatomy, you have to write the limb growth and development. Next, I proceed to my rotation of the limb. This is very important, lateral and medial rotation, and it should be written in the SCQ as well. Next SCQ is your formation of joint, and you have to also do this from the handwritten stuff that I share with you. You just have to read it here, but you have to memorize the stuff that I share with you. Next, it is diagram. If you have enough time, do give a view to this diagram, so if it comes as a SCQ, you can actually maintain it. Formation of joint in short, right? You have to do this. I will summarize it for you from my notes. Next, you have the limb musculature. It is not something important to be asked as a SQ, but limb musculature, you know, you have already done the dermatomes in the upper limb, so you can have a correlate from there. Next, molecular regulation. Molecular regulation is something to be skipped as always. Next is your clinical correlates. These clinical correlates are very, very, very important, especially of limb defects. You have to know what is meromelia, amelia, phocomelia, thalidomide, and this is these thalidomide, the drug which causes these limb defects in the baby. If mother takes thalidomide, the mother will have these defects in her baby, and this is very important, especially phoco, mero, amelia. These are repeatedly asked questions of the past paper. Osteogenesis imperfecta, Marfan syndrome, and arthrogryposis. Of Marfan, you should know a little bit of these, by shortening, bowing, and hypermineralization of long bones of limbs. Only 2 lines are enough for all of these. Like, never do these signals, okay? These are not very important. Just 2 lines of what is the cause and what is the symptom. What happens to osteogenesis imperfecta? There is hypomineralization, long bones of the limb that can result in fracture, and blue sclera. This is more than enough. What is the Marfan syndrome? Cause of mutation in the fibrillin, and in Marfan syndrome, the things that occur in the individuals are swear tall and slender, along with thin limbs and a long thin face. So you have to do this from here. Next to arthrogryposis, congenital joint contractures. This also you have to do only 2 lines of this, so that you can write it in SQ if it comes. Next are very simple short concepts. So brachydactyly, if the digits are shortened; syndactyly, if the digits are fused; presence of extra digit is called polydactyly, and ectrodactyly, absence of a digit is called ectrodactyly. Okay? And ectrodactyly is the second name for lobster claw deformity. Memorize it, read it, write it. Lobster claw deformity come with the words ectrodactyly. Cleft hand and foot, yes, so you should know the cause and effect of the factor as underlined here, cause and effect. So it is clear from here. Bone age, thalidomide, you have done this, all of this. Next is your page number 177. From this page, club foot, you should know club foot is associated with arthrogryposis, and only the underlined information is enough. Next, nothing, this is not important, you can skip. Amniotic bands are referred to your previous chapter, not to this chapter. Congenital hip dislocation is something you will do it in the gross anatomy of lower limb when you read the hip joint. It is the underdevelopment of the acetabulum and head of femur, and its effect include breech posture and laxity of the capsule. So this is your congenital hip dislocation. It is something that is correlated with your gross anatomy. Look for specialized embryo. You have to do it very selectively. You don't have to memorize word by word. You should only have a general pre-concept of it, and you can write in paper and get good marks. For you, I will never recommend you doing long-term memorization explanation of this, because for prof it is not very important to have a long-term explanation of it. So this was your chapter number 10. Chapter 12, limbs.